Welcome to the Medical Device Attribute Navigator Tool webinar presented by GS1 Canada. Today's presenters are Deb Turford, Systems Analyst for Healthcare Materials Management Services, and myself, Rob Bell, Director of Healthcare for GS1 Canada. The agenda for today's webinar includes background information on GS1 and the Healthcare Provider Deployment Committee and the decision to use GDSN for medical devices. We'll also provide an overview of the Medical Device Attribute Navigator tool, and we'll hear from Deborah Turford of the Healthcare Materials Management Services on their use of the tool. This will be followed by a live demonstration as well as a Q&A with today's speakers. GS1 is a global not-for-profit organization that develops and supports use of GS1 global standards. We are part of 111 member organizations serving 150 countries worldwide with 13 million subscribers. GS1 Canada is a member organization of GS1 and collaborates with over 20,000 subscribers across Canada. Subscribers agree to use GS1 standards to solve common challenges, including end-to-end supply chain standards from the point of manufacturer through to patient electronic health records. We're best known for the barcodes and are the only authorized provider in Canada for GS1 barcodes. The Healthcare Provider Deployment Committee is facilitated by GS1 Canada and was formed in 2015 with the following mandate: to advance the roadmap and deployment strategy for the integration of GS1 standards and data integrity protocols, advancing a pan-Canadian initiative to achieve enhanced patient safety, improved health system quality, and overall system efficiencies in the Canadian healthcare sector. The committee is comprised of senior executives from leading healthcare organizations, including hospitals, shared service organizations, and group purchasing organizations. As a community manager, GS1 Canada provides a forum to share standards, leading practices, and enables peer-to-peer dialogue to share learning and communicate successes. The committee is tracking and reporting standards implementation activities across Canada. In collaboration with GS1 Canada, the committee develops tools and resources that advance implementation of GS1 standards by use case. The deployment committee identified the first 3 use cases or business processes to be developed into the implementation guidelines, and these include a global product identification or item setup, order management, and contract management. We encourage healthcare organizations to get involved today and contact healthcare@gs1ca.org for information on GS1 committees and working groups. In July 2016, the Deployment Committee released communications to promote use of the Global Data Synchronization Network, also referred to as the GDSN, for medical device product data synchronization. This position was established by the committee for 2 primary reasons. The first, healthcare providers are each targeting a different set of use cases or business processes with different timelines for vendor data publication requests. And second, although the attributes contained within the GDSN for Target Market Canada, the Target Market Canada Healthcare Attributes Guide remain ideal for the current business and clinical needs, only a limited amount of data is available by medical device vendors today. So the committee agreed to establish momentum for the use of the GDSN to provide medical device product data based on the following principles. Each healthcare provider and vendor would select a GDSN data pool provider of their choice. Vendors will initially be asked to publish what they have. And third, the importance of facilitating clear communication to the vendor community about the attribute needs of each healthcare provider was important to the committee. As such, the committee asked GS1 Canada to host the Medical Device Attribute Navigator tool to communicate detailed attribute requirements by each healthcare provider as a guide for community. GS1 Canada worked with healthcare providers to define common medical device attributes across each healthcare provider. We identified incremental attributes unique to each healthcare provider. And then attribute requirements were cross-referenced to each healthcare provider's business, process, or use cases. Finally, GS1 Canada mapped the global data definitions to each of the healthcare provider attributes to support use in the Global Data Synchronization Network. This collaborative effort led to the development of the Medical Device Attribute Navigator tool. To summarize, the Healthcare Provider Deployment Committee committed to use GDSN for medical devices in June 2016. This was based on the fact that healthcare providers have different product data needs and are at different stages of implementation. At the request of the committee, GS1 was to provide a tool to communicate healthcare product data needs by business process. In October of 2016, the Medical Device Attribute Navigator was launched with 11 providers who have published their attributes in the tool today. This is a complementary tool available to providers and vendors to support continuous improvement of the product data publications in the GDSN. The tool is GDSN data pool neutral and is made available to all healthcare stakeholders. So what is the Medical Device Attribute Navigator? It is a tool designed to provide clarity of the medical device attribute needs of individual healthcare providers. The tool enables dynamic comparison of medical device product attribute needs across multiple healthcare providers, and the tool supports and promotes the use of the GDSN for the medical device product category. The Medical Device Attribute Navigator tool is a neutral support tool that can be used by any healthcare organization regardless of their chosen GDSN data pool. It's a complementary tool provided by GS1 Canada and is available online. The Medical Device Attribute Navigator tool is hosted on GS1 Canada's website, and later in today's webinar, a demonstration of the tool will be provided. So what are the benefits of the Medical Device Attribute Navigator tool? The tool identifies medical device product attributes for individual healthcare providers aligned by common use cases. Healthcare providers can communicate their specific needs, timelines, and key contact information to support catalog publications. A cross-reference of local provider attributes with global data dictionary attributes for use in the GDSN is also provided. The Medical Device Attribute Navigator is available for Tableau Reader, which is a free downloadable data analytics tool to help manufacturers compare attributes by healthcare provider and by use case. As part of a continuous improvement process, the Deployment Committee is seeking your feedback on the Medical Device Attribute Navigator tool and encourage users to send their comments and suggestions to healthcare@gs1ca.org. I'd now like to welcome Deborah Turford from the Healthcare Materials Management Services to speak about her experience in using the Medical Device Attribute Navigator.
Well, thank you for inviting me. My name is Deborah Turford. I'm Systems Analyst with Healthcare Materials Management Services. We are a joint venture with between London Health Sciences Centre and St. Joseph's Healthcare London, created in 1997 to integrate and consolidate the functions of purchasing, accounts payable, inventory management, and logistics. We also partner with Transform Shared Services Organization, who is owned by the 5 hospitals in the Erie, St. Clair region. So we at HMMS have been working with GS1 as a member of the Healthcare Provider Deployment Committee, as well as on the Healthcare Technical Standards Work Group Committee. We've been using the GS1 Canada GDSN since 2016 to obtain GTINs and related medical device product attributes to support 18 business processes, some of which include contract management, item identification and item management, as well as order management. We have been using the Healthcare Attribute Navigator tool to communicate our product attribute needs with our suppliers, and we have been successfully receiving data publications through the GDSN. So I appreciate the opportunity to share my perspective as a recipient of the data. This is an example of the Attribute Navigator. Each healthcare provider has published a standardized yet personalized Attribute Navigator tool in an Excel format. So I'd like to walk you through one of them so you can see the information that's provided for you here. This screen shows the first tab of the Excel sheet labeled Guidance, and you'll see at the top that it explains that the tool was created to communicate our product attribute needs with our suppliers. Under the How to Use section, it explains that the next tab contains the list of attributes. But before we go there, you'll see that this one has a legend. We did this to emphasize the attributes that are the most important to us as well as to clearly indicate the attributes that can wait. So you'll see we have mandatory, critical, important, and optional, but just know that we use all of the data. But this should clarify which ones are most important to us. Second to last column explains that the first 3 columns in the next slide map to the Global Data Dictionary. So let's take a look at that, please. This slide shows just a quick overview of the attribute Navigator that lists all the attributes that are important to this healthcare provider, which would be HMMS, of course, in this example. We've customized it. And if you'll just as an overview look at the very top, there's a legend that explains the types of data that's provided in each column. So for example, the first 3 columns in blue give the common attribute names from the Global Data Dictionary to simplify your cross-referencing and mapping. If you look at column D, contract number is the name that we've given to the attribute. And if you look in column E, this is where we define it and maybe even give you an example about how we use it. Column F, date required, simply means that that's our effective date and we are using the data effective that date. And we would like to begin receiving this data from the suppliers if they have it available. Then columns G, H, and to the right indicate the business processes that are supported by that attribute. And column E, notice that under provider definition for optional, that is optional for the publication. But just know that you can see we're using it. Now that as opposed to the mandatory beneath it, the data provider GLN, that's definitely a mandatory attribute. And we would consider that that's important to be published in your very first publication. So this is how we emphasize what's important to us. Each healthcare provider will have a different definition and different emphasis, as you'll see when you look through each of their sheets. Just to note, there are 26 attributes in this sheet, but only 6 of them are labeled as mandatory for now. As the other attributes become available by manufacturers, such as those labeled as critical, like latex, for example, you could go ahead and publish it at that time, but it wouldn't prevent you from publishing what you have to us right now. Because outside of this environment, we still do have to obtain all of this data. And that usually involves phone calls and emails and spreadsheets being shared back and forth. So that we're hoping that over time, this publication and the use of this tool will save everybody time, eliminate the spreadsheets, as well as all of those emails. We have received a lot of benefit by using this tool, and I'd like just to recap that with you. This tool provides a great deal of clarity about the product data that's needed by each individual healthcare provider. It's in a standardized format. Just this one tool can communicate attribute needs in a consistent manner. It's also very flexible because it can be used in conjunction with your own data pool. And as you saw, the cross-reference to the Global Data Dictionary is available and handy, and it's a complementary tool available by GS1 Canada to support the adoption of the GDSN for the medical device category. And just to finish, I'd like to say that we've been successful engaging many of our suppliers to use the Attribute Navigator to publish their data to us. So I'm hoping that this overview encourages those of you that are working toward that goal to begin publishing to us what you have to us now. So consider publishing the mandatory attributes, for example, maybe by contract. You can start small and add as more data becomes available. So I'd like to ask that you please consider and reach out to me and all other healthcare providers to begin the publication process. I think you will find that it's a valuable collaboration tool that will benefit everyone. Thank you.
Thank you very much, Deborah. We're now going to get into a live demonstration of the tool, and we will, as we go through this, we'll find out where the tool is located on GS1 Canada's website. We'll also go through and understand how to download the Excel version of the tool to access individual healthcare provider attribute lists, as well as downloading the Tableau Reader version of the tool for manufacturers to compare product attributes. First thing is, let's look for where this tool is available. Now, as you can see on screen here, when you open up your browser, you go to gs1ca.org, and that'll take you to our GS1 Canada's landing page. From there, you can go to Sectors and select Healthcare. This landing page contains all the healthcare information, including use cases and reports and standards implementation guides. Within this section, you'll find information such as the Medical Device Attribute Navigator tool. There's a link to it. You simply click on that and you come to the Attribute Navigator tool landing page. There's some rich information here. Again, I encourage everybody to take a look. There is a Deployment Committee Statement of Direction for Canadian Healthcare that's available to download. There's also a letter provided by the Deployment Committee regarding GDSN, which was covered off earlier today. In terms of navigating the attributes, we try to break this down into three simple steps. The first is to review the medical device product attributes and guidance files below for each healthcare provider. What manufacturers can do is simply go down to the bottom where it says Healthcare Provider Files. When they expand on it, they can now see which healthcare providers actually have loaded their product information into the tool. And we have 11 organizations, so we have BC Clinical and Support Services have loaded their information by site. We have Healthcare Materials Management Services, Mohawk Shared Services, Plexus, Shared Services West, and Shared Support Services Southeastern Ontario, who have loaded this information into this tool. By simply clicking on one of those links, you will be able to open up the Excel version of that tool. And some of this information Deborah already covered off in her presentation. So the Guidance tab contains information from that particular organization as guidance to the manufacturers on the type of product information they're looking for. Again, very simply, healthcare providers are looking for manufacturers to load and publish the information they have available today, and at the same time, understand the individual product attribute information requirements of healthcare providers so they can continuously build towards improving their data. You can see the tabs at the bottom. The first tab is Guidance, and the second tab would contain the actual list of the attributes. Again, the legend is provided at the top. The first three columns are those cross-reference to the Global Data Dictionary terms that can be used with your data pool if you're a manufacturer. And as you start to go across, as Deborah had mentioned, columns D and E contain the healthcare provider's own attribute name that they use internally, as well as their definition of that attribute, followed by the date required, and then finally to the right, the various use cases or business processes that provider is using that information for. And it has filters so that you can actually go and sort through the information. Manufacturers are encouraged to review this information as they're starting to understand the type of product information healthcare providers are looking for. Now we'll go into the next part, which is part 2 of the Attribute Navigator tool. And this part here is used for manufacturers. And I'll just quickly show you from our website before we go into the tool where to access the information from. So we go back to our landing page. And again, this is where the Attribute Navigator tool is hosted. We go back down to our steps. And in step 1 here, we've already gone through the process of looking at an Excel tool, and that would be to understand individual provider requirements. Manufacturers may want to start to look at how the provider's data requirements compare to other healthcare providers. They can download a consolidated file and store it locally. And then the second thing is they download the latest version of Tableau Reader. And this is a free tool. The Tableau Reader tool is free for download and use. And once you've installed it, you'll be able to open up the consolidated file and view that information. So I'll now go through a little bit of what that tool looks like. So you can see on screen here, the first tab is some basic an introduction or an overview of the Healthcare Attribute Navigator with some guidance tips. For example, because of the number of attributes and the number of providers and business processes that can be contained in the tool, it can get quite busy. So we recommend looking at maybe 3 to 4 hospitals at any given time maximum and using the drop-down list within the tool so that you don't overwhelm yourself with the information. So as we go into the tabs, you start to look at the information in the tool here. So you notice that we have a legend on the left-hand side, so we can look at the hospital IDs and figure out which hospitals are within this tool. Right now I've selected HMMS. You can then take a look at the business processes within the tool, and again selecting them on or off depending on what your preference is. The global data dictionary terms are also located here. You can turn them on and off depending on what you want to view, as well as the date required for information, which will appear on screen. Again, what you're seeing in the Tableau version is similar to the Excel version, although what's different now is that you'll be able to look at more than one hospital at any given time. So to simplify it for this webinar, I've chosen to look at healthcare materials management services and look at 3 business processes: contract management, item management, and order management. And as you can see here on the left, in the middle section here, the attribute name represents the term that HMMS uses to identify that attribute themselves. It also identifies the date that they are looking for that information to be provided by manufacturers. On the left-hand side is those global data dictionary mapping terms that can be expanded by simply moving the columns left to right to make it easier to read, or to mouse over the information. You'll also notice that if you mouse over the information in the boxes, the same level of information it starts to appear. Now at this point, we're just looking at healthcare materials management services. For the sake of this demo, we'll open up one additional file, and this will be Shared Services West. And what you begin to see is a lot more information coming on screen. And again, for the same business processes here, contract management, item management, and order management, you can begin to see how each healthcare organization starts to describe the information. As an example, when we go down further, we look at G10. We can see that and for contract management, Shared Services West would like to have this information. For the item management use case, Shared Services West and HMMS would both like to receive this information. And for order management, you can see that Shared Services West is going to use that information to support order management. Again, the definition of how they identify it internally is listed, plus the global data dictionary terms. In some cases, hospitals will use different naming conventions to identify information. So it could be a manufacturer product identifier or a vendor or seller code. These attribute definitions are both represented because both providers are using that as their own internal terms. The global data dictionary term maps back to one common identifier that can be used in the GDSN. And again, if you look here, you can see that Shared Services West and HMMS are both looking for this information to support contract management, item management, and order management. So that's a brief demonstration of the tool. I encourage organizations to go in, follow the instructions to download. Again, as we provide more data to healthcare providers and they start loading into the tool, you'll always want to check back maybe on a monthly basis to see if there's an updated consolidated file. Also, I've noticed that in Tableau Reader they do periodic updates, so you'll want to just go through that process and keep the version of Tableau that you're using updated. We encourage organizations in step 2 here, if you're not already working with a global data synchronization network data pool, is to start talking to the data pools and finding out what they offer. You can work with GS1 Canada GDSN data pool, or you can go on and we provide a global directory for the other data pools that are available. And then finally, once you are connected to the GDSN, start working with the relevant healthcare providers to arrange publication of your product catalogs to those organizations. So now we're going to go back to the presentation here. So the steps for vendors and manufacturers. So visit gs1ca.org to learn about GS1 standards. establish a connection to the GDSN through any GDSN certified data pool, visit www.gs1ca.org and select the healthcare sector and download the Medical Device Attribute Navigator tool. Review the product attribute information needs of your trading partners, and finally, load and publish your product catalog data into the GDSN. Some next steps for healthcare providers, including hospitals, shared service organizations, and group purchasing organizations, again encourage you to visit gs1ca.org to learn about GS1 standards. Contact GS1 Canada to create and publish your own medical device attribute needs into the Medical Device Attribute Navigator tool. You can contact us by emailing us at healthcare@gs1ca.org. In this process, you'll work with GS1 Canada to determine your product data needs aligned by the business process, and then GS1 Canada will in turn add global data dictionary terms that can be used and published in the tool. We're also asking you to, as healthcare providers, to establish a connection to the GDSN through any GDSN certified data pool and subscribe to vendor product catalogs in the GDSN. So as a summary, to the healthcare providers and manufacturers, we want you to stay informed. So subscribe to the GS1 Healthcare and Pharmacy newsletter, your resource for GS1 Global Standards. Access the GS1 Canada Learning Zone to fully understand the benefits of implementing supply chain standards. And those organizations we're reaching out to join the Healthcare Technical Standards Workgroup or Healthcare Provider Deployment Committee. We want you to get involved today and help shape the path for standards development and implementation in Canada. So contact us at healthcare@gs1ca.org. As a summary of today's webinar session, GS1 Canada's Healthcare Provider Deployment Committee is advancing a roadmap for use of GS1 standards in Canada's healthcare system. The committee is advocating for the use of Global Data Synchronization Network, or GDSN, for the exchange of medical device product data, and the committee endorses the use of the Medical Device Attribute Navigator tool to communicate medical device product attribute needs of providers and encourages vendors and manufacturers to start using the tool and the GDSN today. We're now going to take questions for both panelists. Is it only hospital using this information, or do retailers use this for listing information, i.e. pharmacies? That's a really great question. Today, this tool is being used specifically by hospitals, group purchasing organizations, and shared service organizations to support the loading and publication of medical device attribute information into the Global Data Synchronization Network. Are there any other questions? I did have one piece of feedback. Somebody had commented that this is a great example of how to manage attribute mapping and priority. Again, that was the spirit of what we intended here. As we worked with the community over the past several years, trying to come to an agreement on a single target market list of attributes, we recognized pretty quickly that healthcare providers are working on different use cases. In fact, we had identified over 50 different use cases and definitions. Healthcare providers are each working on various use cases and have different timelines. To support their efforts to use GS1 standards, including the Global Trade Item Number, and using the GDSN to access medical device data, the decision from the deployment committee was that GS1 would create a tool to communicate out to manufacturers the information needs for each of these individual healthcare providers. Again, the key message here is the manufacturers, once you're in the GDSN, load and publish what you have today. Healthcare providers would like to get going on this now and not wait for the perfect record, but to try to get as much information as possible. Secondly, use the Medical Device Attribute Navigator tool to start to work towards continuous improvement and completeness of your product data into the GDSN. Okay. At this time, I want to say thank you very much to Deb Turford from HMMS for sharing her thoughts and experience today with the group. And also, I'd like to thank everyone here for joining us on this webinar. On screen, you'll find contact information, and ask that if you have any additional questions, please reach out and let us know your thoughts on today's webinar, as well as if you're interested in whether you're a healthcare provider who wants to start to use the Attribute Navigator to communicate your information needs, or you're a manufacturer or vendor who's starting out in the GDSN and would like to get going to start using this tool to support your customers' needs, please reach out to GS1 and we'll be happy to support. Thank you very much again for attending today's webinar.